In this video, I'm going to talk about wrist arthritis. I'm going to look at the different types that we see, what the symptoms are, how it's diagnosed, and what the treatment options are. I'm Stephen Bunting. I'm a specialist MSK physiotherapist working in the UK. Welcome to my channel, where I explore the common MSK problems that affect everyday people and the evidence-based treatments that can help. So before we get started, it might be a good idea just to quickly summarise what osteoarthritis is. So it's a degenerative condition that affects the joints and particularly the cartilage that lines the joints. So the normally smooth, slippery cartilage becomes thin, roughened and degenerative, causing symptoms of joint pain, stiffness and sometimes swelling. So that's the basics of osteoarthritis, but if you want to know more about this condition, then I've done a separate video looking at it in much more depth, which you can see up here or in the description below. Now, osteoarthritis can affect any synovial joint, which is pretty much all of the joints in the hand and wrist, and there are lots of them, 27 bones and joints in total. In the wrist itself, we have three main joints, the radiocarpal joint, the ulnocarpal joint, and the distal radio-ulnar joint. And arthritis in each of these joints will have slightly different symptoms. So let's start by talking about these symptoms and how you might know if you have arthritis in one or more of these joints. So the general history that I hear from people with osteoarthritis is that their symptoms usually started slowly over months or years and became progressively worse over time. They talk about pain, usually when moving the joint in question, and then a progressive amount of joint stiffness. The joint might feel like it's grating or grinding with movement, and it might swell up from time to time. And typically, their arthritic joint might grumble along at a fairly steady level and then flare up from time to time, causing an increase in pain and swelling for a few weeks before settling back down again to its usual background level. And that background level of pain can be mild right through to severe and debilitating, depending on the degree of arthritis. So those are the universal symptoms of an osteoarthritic joint. Now, I'm going to talk about the specific symptoms associated with arthritis of the three main wrist joints. But if you're at this point of the video and you think you might have wrist arthritis, then do go and get a wrist x-ray, because this is by far the most useful investigation to check the health of the individual wrist joints. Here we have a normal wrist x-ray showing the radiocarpal joint, the ulnocarpal joint and the distal radio-ulnar joint. And here we can see x-rays showing arthritis of these three joints in turn. So you can see how useful an x-ray can be to help diagnose the condition and in determining which specific joint might be involved. Okay, so let's now look at the typical symptoms. And with the main wrist joint, the radiocarpal joint, your pain is going to be around the central and sometimes the thumb side of the wrist. The wrist might ache and feel stiff, particularly during the flexion and extension movements. And you might get periods of swelling, which usually affect the back of the wrist around here. With the distal radio-ulnar joint, the pain will be more over the little finger side of the wrist, just here, near that bony prominence which is the head of the ulnar bone. This time the painful movement is forearm pronation and supination like this, and there might be a crunching or grating sensation during these movements. Now, I've covered DRU joint arthritis separately, including all the different treatment options in a separate video which you can see up here or in the description below. So if you think your wrist pain might be due to the DRU joint, then do go and check that out, because I won't be covering it any further in this video. Now, the other wrist joint, the ulnocarpal joint, is also painful over the little finger side of the wrist, but in a slightly different place to the DRU joint. In ulnocarpal arthritis, the pain is usually just distal to the ulnar head, around this region, and the painful movement tends to be ulnar deviation, which is the karate chop movement, particularly when combined with forearm pronation and supination. So, an activity like using a screwdriver is going to be painful for this joint. And again, if you think your symptoms are looking like an ulnocarpal joint problem, then I've also covered that joint in another video, which I'll link to up here and in the description. So from this point onwards, I'm going to be concentrating on the main wrist joint, the radiocarpal joint. So let's move on to the treatments. I'm going to start by talking about diet and supplements, only because if I don't, then the comments section will be full of people's personal experiences and sometimes amazing results from taking a supplement or changing their diet. Now, unfortunately, there is very little clinical evidence to support specific dietary changes or individual supplements for arthritis, but there is a broad acceptance that eating a well-balanced Mediterranean-style diet based on freshly prepared whole foods, low in sugar and refined carbohydrates, and rich in fruit and vegetables can undoubtedly have a positive influence on your general health and many different medical conditions, including joint pain. There is less evidence to support particular supplements, but that's not to say they won't help you. Now, I've covered diet and supplements for arthritis in a separate video, which you can find in the description below. So if you are interested in dietary changes, then do go and check that video out. Okay, so now on to the more established evidence-based treatments, and the first thing that most people will find helpful, particularly if the wrist is very painful and perhaps swollen and generally flared up, is the use of a wrist support to provide the arthritic joint with a period of relative rest. And I don't mean total rest for the long term, I just mean a temporary reduction in painful wrist activities until the pain has settled down to a more tolerable level. And then, depending on individual circumstances, people might then choose to use a wrist support or a splint for the longer term in order to prevent any further flare-ups. So something like this will be effective in supporting the wrist joint, and I'll put links in the description. Now, if the pain doesn't settle down with rest or a splint, or if the wrist is visibly swollen, then the joint is probably inflamed, and therefore the use of anti-inflammatories, either oral or topical gels, can often be helpful. But please do consult a prescriber or a pharmacist first, as not everyone can use anti-inflammatories. And I certainly wouldn't recommend using these medications for the long term, but taken for a few weeks, they can often be really helpful in reducing an arthritic flare-up or settling down a painful episode. And if your arthritic wrist continues to be painful and or swollen despite rest, using a splint and perhaps taking a course of anti-inflammatories, then the next treatment option would usually be a cortisone injection. This can be done as a simple outpatient procedure in a doctor's surgery, but my preference is to do it using ultrasound guidance, which ensures accuracy because you target the specific arthritic joint. And a cortisone injection can be very, very helpful in settling down pain and swelling. Now, all of the treatments I've discussed so far are aimed at settling down a flare-up or reducing your wrist pain to a more manageable level. Once this has been achieved, then I would advise starting a gentle exercise program. The idea of this is to try and strengthen the wrist and therefore making it less likely that it will flare up again. Your wrist will still be arthritic, but it will hopefully be stronger, more resilient and better able to cope with your day-to-day activities. Now, I've done a separate video demonstrating a great general exercise program which I'll link to in the description. It's divided into 3 parts, but for wrist arthritis I would recommend just doing parts 1 and 2. Part 1 is a stretching program aimed at improving mobility, and Part 2 is a basic strengthening program. Part 3 is an optional set of advanced exercises which I wouldn't usually recommend for the vast majority of arthritic wrists. And just to reiterate, you should only start exercising your wrist when it's settled down and not angry or swollen, Otherwise, you risk flaring it back up again. Okay, so hopefully by following the treatment suggested so far, your arthritic wrist pain will have settled down and your wrist is now stronger, more capable and generally much improved. But what if it's not? What if your arthritis is more advanced and causing you significant pain on a daily basis? What then? Well, there are some other injection options. Viscosupplementation injections, usually consisting of hyaluronic acid, can be helpful in some cases. They aren't going to cure you, but they can improve symptoms, although they might need repeating every 6 to 12 months. Similarly, things like PRP injections or stem cell injections are another potential option. Unfortunately, the evidence for these isn't convincing though, and therefore I can't recommend them for everyone. But do your own research, as they might be worth considering in your case, especially if other options aren't available to you. And of course, clinical research is ongoing, and we all have our fingers crossed that these treatments can become refined, improved, and ultimately more effective in the future. And finally, if you've reached the point where you are thoroughly fed up of your arthritic wrist and you feel that you've done everything you can to settle it down yourself without any joy, then surgery is the final option. For nearly all types of wrist arthritis, there will usually be a surgical option, provided that you are healthy enough to cope with the procedure and the anaesthetics. Now you can roughly divide the surgical options into two: joint fusion or joint replacement, and there will be cases where one will be the better option depending on individual circumstances, and so you will need to discuss your individual case with a hand surgeon. Fusion usually involves permanently stiffening the arthritic wrist joint using pins and plates, and sometimes a bone graft. But the end result is that your wrist joint won't move anymore, but as a result it shouldn't be painful anymore either. And this can be a really good option for some people. Having a permanently stiff wrist isn't as bad as it might seem. You will still be able to move your forearm and your thumb and fingers, so overall hand function is still pretty good. The other option is wrist joint replacement, and the advantage of this is that you will still have some movement in your wrist. But the downside is that it's not going to be very strong. For example, you're not going to be able to do press-ups through a wrist replacement. So the trade-off in having some wrist mobility is accepting a degree of weakness. In fact, lifting a 1 kilogram bag of sugar is about as good as you're likely to get strength-wise after a wrist joint replacement. So you're not going to be able to do anything like racket sports, using power tools, and you won't be able to put much weight through that wrist, because if you overdo a wrist replacement, it's going to wear out quicker or loosen, therefore needing further surgery. So if you are younger, more active, and wanting to have full wrist strength after surgery, then a wrist fusion is usually a better option for you, and indeed that's what I would choose at my age and wanting to keep playing golf and going to the gym. Wrist replacements are a better option for people with a more sedentary life or who might have retired and are able to avoid those strenuous activities. Okay, well that's about it. I do hope you found the video helpful. Don't forget to look in the description for the links to the other videos that I mentioned, and please consider subscribing and liking the video, as it really helps it get seen by more people who might also benefit. Okay, well until next time, take care and bye for now.